She almost didn't come in. That's what her daughter told me afterward. Margaret had been noticing something for weeks, a quiet, persistent pressure in the back of her head every morning. Not painful enough to call an emergency, just there. She figured it was stress, maybe poor sleep, maybe just getting older. She was 69. She was active. She ate reasonably well. She had no reason to think anything serious was happening. But when she finally sat in my office and I checked her blood pressure, it was 178 over 104. That number doesn't just mean a little high. At that level, the tiny blood vessels feeding your brain are under the kind of constant pressure that silently raises your risk of stroke with every single hour that passes. And Margaret had been walking around like that for weeks. Here is what stopped me cold, though. When I looked at what she was eating, I noticed something. Not what was missing from her diet, but what was sitting right there in her kitchen every single day, completely underused. Fruit. Specific fruits, with specific compounds inside them that directly target the mechanisms that drive high blood pressure after age 60. She was eating them occasionally, not strategically, not consistently. And that difference between occasionally and strategically is the difference that changes everything. By the end of this video, I am going to give you 5 fruits grounded in real science that you can start using today. Not as a replacement for your medication, I want to be very clear about that from the start, but as powerful, natural allies that work alongside whatever your doctor has prescribed. Stay with me, because what I'm about to share is not common knowledge, and it should be. My name is Dr. Albert. I have been a practicing physician for 32 years, specializing in geriatric cardiovascular health, which simply means I have spent 3 decades focused on what happens to the heart and blood vessels as we age. Over those years, I have had thousands of conversations with patients in their 60 seconds, 70 seconds, and 80 seconds who were frustrated. Frustrated because they were doing everything right, taking their medication, watching their salt, reducing stress, and their blood pressure was still not where it needed to be. What I found consistently is that most of them had never been told about the nutritional side of this equation, not in any real, specific, actionable way. That is what this channel is for. And that is what today's video is about. After 60, blood pressure becomes one of the most dangerous quiet threats to your health. I say quiet because high blood pressure has no dramatic warning signs most of the time. It does not hurt. It does not announce itself. It simply builds. And the stakes are enormous. According to major cardiovascular health organizations, uncontrolled high blood pressure is the leading modifiable risk factor for stroke, heart failure, and kidney disease in adults over the age of 65. But here is the part that most people do not fully understand. After 60, blood pressure is not just about salt and stress anymore. Something structural is happening inside your arteries. The walls begin to stiffen with age. They lose the elasticity they once had. And stiff arteries cannot absorb and distribute blood flow the way younger, flexible vessels can. The result? Your heart has to pump harder, your pressure climbs, and over time, that constant elevated pressure begins to silently damage the delicate vessels in your brain, your kidneys, your eyes, and your heart itself. This is why medication alone is often not enough. Medication manages the pressure, but the right foods, the right fruits specifically, can actually begin to address the underlying causes. Stiffness, inflammation, and oxidative stress inside the vessel walls. Think of your blood vessels the way you think about a rubber band. When it is new, it stretches easily, absorbs tension, snaps back. But leave that rubber band sitting out for years, expose it to heat and stress and time, and it becomes brittle. Pull it, and it resists. Pull too hard, and it breaks. Your arteries go through something very similar as you age. The process is driven largely by oxidative stress and chronic low-grade inflammation, 2 forces that erode the inner lining of your blood vessels, called the endothelium. When the endothelium is healthy, it produces a molecule called nitric oxide, which tells your vessel walls to relax and stay flexible. When the endothelium is damaged by oxidative stress and inflammation, nitric oxide production drops, the vessels stiffen, the pressure rises. Now, here is what makes certain fruits so remarkable. Many of them contain natural compounds, polyphenols, flavonoids, potassium, and nitrates that directly support nitric oxide production, reduce vascular inflammation, and help restore some of that flexibility to aging vessel walls. This is not folklore. This is established biochemistry. And it is why I now routinely discuss these 5 fruits with every patient managing blood pressure. Let us go through them. The first fruit that deserves a permanent place in your daily routine is the banana. I know that sounds almost too familiar to be powerful, but hear me out. Bananas are one of the richest dietary sources of potassium available to us, and potassium plays a direct role in blood pressure regulation that most people have never had properly explained to them. Potassium works as a natural counterweight to sodium. When you consume enough potassium, your kidneys are able to excrete more sodium through your urine. Less sodium in circulation means less fluid retention. Less fluid retention means lower pressure on your vessel walls. It is elegant, it is natural, and studies have shown that increasing dietary potassium can produce meaningful reductions in systolic blood pressure in older adults, particularly those who consume too much sodium, which, in my experience, is most of us. 1 medium banana a day. That is a starting point worth taking seriously. The second fruit is one that tends to surprise people: watermelon. Not because it is exotic, but because of a specific amino acid it contains called L-citrulline. When you eat watermelon, your body converts L-citrulline into L-arginine, which then directly stimulates nitric oxide production in the endothelium, those vessel walls we talked about. Research has found that regular watermelon consumption can produce a measurable reduction in blood pressure in middle-aged and older adults with hypertension. 2 generous slices a day, and you are giving your vascular lining exactly what it needs to relax. If this is giving you information your doctor's appointments never had time to cover, please subscribe to this channel. Every week, I bring you evidence-based health guidance designed specifically for adults over 60. Because you deserve to understand what is happening inside your body and what you can actually do about it. The third fruit is pomegranate. And I want to spend a moment here because the research on pomegranate and blood pressure is genuinely impressive. Pomegranate is dense with a class of compounds called punicalagins, which are powerful antioxidants that reduce oxidative stress in the arterial walls. Several clinical trials have shown that drinking just 4 to 8 ounces of pure pomegranate juice daily for a few weeks produced significant reductions in both systolic and diastolic blood pressure. One study published in a respected nutrition journal found systolic pressure dropped by an average of 5 to 8 points in hypertensive adults. That is the kind of shift that doctors notice. The fourth fruit is something many of you already enjoy without realizing how hard it is working for your heart: blueberries. Blueberries are extraordinarily rich in compounds called anthocyanins, the same pigments that give them their deep blue-purple color. And these anthocyanins have been shown in multiple studies to improve arterial flexibility and reduce blood pressure, particularly in postmenopausal women and adults over 60. One long-term study from Harvard found that regular blueberry consumption was associated with an 8% reduction in hypertension risk over time. A handful a day, fresh or frozen, both are effective. The fifth fruit brings us full circle to where we started: kiwi. Most people think of kiwi as a vitamin C fruit and leave it at that. But researchers at the University of Oslo conducted a controlled trial in which adults with slightly elevated blood pressure ate 3 kiwi fruits per day for 8 weeks. The result was a significant reduction in both systolic and diastolic blood pressure, greater than what was seen in the control group eating 1 apple a day. The working theory involves the combined effect of kiwi's folate, potassium, vitamin C, and antioxidant compounds acting together on the vascular system. 3 kiwis a day sounds like a lot, but split between breakfast and a snack, it is entirely manageable. I want to tell you about Kendrick. Kendrick was 72 when he first came to see me. Retired school principal, proud man, careful man. He was already on 2 blood pressure medications and had been for 4 years. His numbers were controlled, but barely. His doctor had been talking about adding a 3rd medication, and Kendrick was not happy about that. He told me he wanted to do more. He wanted to feel like he was fighting back, not just managing. We talked about these 5 fruits in detail. I did not ask him to overhaul his diet overnight. I asked him to do one thing. Add at least 2 of these fruits to his daily routine, consistently, for 60 days. He chose bananas and blueberries first. 2 months later, he came back. His morning readings had dropped noticeably, enough that his cardiologist decided to hold off on the 3rd medication and reassess. By month 4, he had worked in pomegranate juice 3 times a week and kiwi most mornings. His inflammatory markers had improved. His energy was better. He told me he felt like he had taken something back. That is what I want for you. Not just managed numbers, actively better health. Here is what I want you to take from today's video and act on. Start with 1 fruit from this list, whichever one you already enjoy or can access most easily. Commit to it daily for 3 weeks before adding another. Consistency matters far more than variety in the early stages. Track your blood pressure at home, ideally morning and evening, and note any gradual changes. Share those numbers with your doctor at your next visit. If you are on blood pressure medication, do not adjust your dose based on dietary changes alone. Bring this information to your physician and have that conversation together. Watch your sugar intake with fruit juice. Pomegranate juice, for example, should be pure with no added sugar. The added sugar will undermine the cardiovascular benefit entirely. And if your blood pressure spikes above 180 systolic, or you experience sudden headache, vision changes, chest pain, or confusion, do not wait. Seek emergency care immediately. Those are not symptoms to manage at home. Margaret, the patient I mentioned at the beginning of this video, she made 2 changes in the first week. Banana every morning, a handful of blueberries in her yogurt at lunch. Simple, consistent. Within 6 weeks, her pressure had come down to 148/88. Still work to do, but moving in the right direction for the first time in years. She told me at her follow-up, "I just needed to know what to do." That is all any of us need. Clear information, a place to start. Your blood vessels are not fixed. They are living tissue. Give them the right support, and they will respond. I want to know, which of these 5 fruits are you going to add to your routine first? Leave your answer in the comments. I read every one of them. And if this video helped you, please share it with someone you love, a parent, a sibling, a friend managing blood pressure. Sharing this takes you 2 seconds, but it could genuinely change someone's health. Subscribe if you haven't yet. Next week, I'll be sharing the 5 most dangerous foods for seniors with high blood pressure, including one that most people consider healthy. You will not want to miss it. Take good care of your heart. It has never taken a single day off for you.